and
about
that
this.
will be safe, correct? To be use it if he wants to use it like, more than twice a day, because he tend to be like this, because we used to have the MR4, and they already told me don't use it more than, 3 minutes each. But my son will use it like about, 20 times a day,
It's fine.
because he's just, he feels good about it. He feels better.
I agree. I don't think we are leaving it up to mom and son, Nathan, to figure out how much. Okay. Because the only thing is we're not going to say, I'm just saying, we have no side effects.
Okay.
We can see no side effects. So
Uh-huh.
means go, what do you want to do? Do a little bit or do a lot? Let's do it till he feels like he doesn't want to do it anymore type of thing. So I'm with you.
Yeah, is the nose, is the penetration from the nose deep enough that can reach the brain, do you think?
Well, I do, but I'm a little prejudiced. But I think that the evidence suggests that yes, we can get a signal to the brain either through increased circulation, but I think it's actually activating the prefrontal cortex.
Okay.
I think that we have enough signal to show that. So let me show you the research because you're going to be up to speed. Okay.
Yeah. Mm-hmm.
So autism spectrum disorder is a lifelong developmental disorders, difficulties with socialization, reciprocal communication, repetitive behavior, sensory integration problems, affects about 2% of the youth, and there's no established pharmaceutical treatments. Communication, behavioral, and social functioning would be the triad, I suppose.
Uh-huh.
We understand that photobiomodulation is light coming into the body, into cells and tissues and changing them. Okay, so it may, we say here that transcranial photobiomodulation reduces pro-inflammatory cytokines, right? Reduces infiltration of macrophages, activates microglial cells, may stimulate neurogenesis and neuroprotection, increase brain BDNF, which is important, and pro-apoptotic molecules. We know that transcranial increases oxygenation, can change connectivity. We can neurooscillate the brain tissue and brain waves, promotes angiogenesis, increases BDNF, produces more ATP, stronger mitochondria, may increase cognition, accelerate neuronal activation, and now that we're talking about brain drainage for detox. Mm-hmm. This is one of the first studies was done, the effects of low-level laser therapy on autism spectrum disorder.
Yeah. Can I take a picture of these so I can read it later?
I'm going to send you I'll send you the video.
Okay.
This was done in Cuba, I think, or started in Cuba.
Okay.
This is the paper.
Uh-huh.
Okay. And we're going to review it this way a little bit. They looked at 21 of the 40% participants received 8 5-minute procedures administered at the base of the skull and the temporal area across 4 weeks. So that is like 1/8 of what we're going to attempt to do, right? Mm-hmm. And they looked at irritability, lethargy, stereotypical behavior, height. Let me see if I can do my annotate with my spotlight. Non-compliance, inappropriate speech. They use the clinical global impression scale. What that means is you look at him and you just say, I think he's better.
Yeah.
Okay. So let's take a look at it. The global score, they saw a reduction in aberrant behavior. Uh-huh. They saw a reduction in irritability. Mm-hmm. They saw a reduction in lethargy or social withdrawal. Okay. They saw a decrease in stereotypical behavior. Mm-hmm. They saw a decrease in hyperactivity, and they saw a decrease in inappropriate speech against the sham control. Yeah. So these are big movements, right? Yeah. And what they also found is that the participants' percentages in the severity of illness subscale. So the placebo didn't change, but these participants had a significant reduction in how that they think that this was the global impressions of severity was significantly reduced or showed a great reduce. So in these two groups, much improved in the, which one is this now? In the clinical change, right? Whereas the no change in the placebo group. And in the test group, the improvements of the subscales also showed everyone improved in the test group.
Okay. Before you go on, before you move on, I have a question. Is this, in this study, that study that you just showed, is the same wavelength?
I'm going to show you. I'm going to show you.
All right.
Now, it was a double-blind RCT with 5 to 17-year-old people.
Got it.
They used 635 red to the temporal region and the base of the skull. Twice a week, 5 minutes. Wow. That's really not that much.
Yeah, right.
And these were LEDs. And these are the changes that they showed. Again,
I want that one. I want the inappropriate speech because that's what my son has, you know, and the stereotype. The stereotype also, it comes in OCD. The rest is probably okay. He's not lethargic. He's not irritable. He's not a hyper. But those two is like mainly him.
Okay. Well, we can change it. We can look at that and maybe address it specifically. But basically, everybody got, you know, the treatment group at bed. Basically, irritability subscales was significantly more effective than placebo in treating the symptoms of ASD in children and adolescents. Okay. And this is another one. They looked at, this is the same researcher, Machado. And this is one that showed in 2019. So that was 2018. This is 2019. Low-level laser therapy in autism. And so let me see if I did this. Let me see if I can get this done here. So they looked at the first study and they looked at these improvements, and to continue the procedure produced an aggressive, meaningful improvement up to 6 months following the completion of the procedures. So they didn't really, I believe they didn't have to continue to do it, but they continued to see people. Yeah. So they used a very, it was a laser versus LED, but very low power and very low things, and continued to affect a progressive and meaningful improvement up to 6 months following the completion of the procedures. So it was a lasting thing. These results suggest that PBM interventions should be applied to us as early as possible in a lifetime. So they looked at this. So this is the guy that did this research: efficacy of transcranial infrared light therapy in ASD, interim analysis of an open label proof of concept thing. This is what they talked about, okay? Was these changes right here using LEDs. I'm gonna go over it right now. And it was put a couple of places, so I'm just showing you that it's actually published research, and this is the guy that presented the other day, last month, okay? And what they found is that the PBM treatment was associated with improvements in the core features of ASD as well as executive function and significant improvement in overall function. The 98% rate of adherence to scheduled study visits and procedures suggests a high potential of acceptance of this non-invasive intervention. TBM is safe, feasible treatment approach, and further research is needed. Let me show you what they found. They had intact language skills, this group, and they used 830 wavelength. So they used the infrared, right? And just to let you know, they did 2 of them, and they only treated the temporal region. Continuous light, you understand? Continuous light, did not pulse. So we have the red and we have the infrared, and it's continuous. Does that sound like it's going to work? I think so. So they use the same thing, global impression and social responsiveness scale. That they're looking for these changes. The social responsiveness scale measures social.
Is near infrared and infrared the same, right? Or no?
Yeah, that's pretty much the same. Okay. Pretty much the same. Is a social ability. It is used primarily with individuals. Okay, that's the test. So they looked at social awareness, social cognition, social communication, social motivation, and restricted in repetitive behaviors. Okay. This one here is the global impression of severity, okay, which is no change, borderline ill, severely ill, very ill. And this one is the impressions of improvement, which they say, how much did they change? So this is just you tell them, I think he changed this much. I think he's this sick. So much improved, very much improved. These are the scales that we can use.
Yeah.
So for you to tell me how sick is he, right?
Okay.
In these factors, and then how much did he improve?
Right.
Very simple. This is what they used, infrared light, 20 to 30 minutes per exposure. You got it? So 20 minutes 3 times a week, then 25 minutes twice a week, then 30 minutes 3 times a week.
Okay.
Again, we're going to exceed these parameters because we're going to start low, but we're going to do up to 20 minutes twice a day. So we can go from this 20 minutes, 10 minutes, I don't know, every once in a while, to a full blown doing it a lot. Okay, so the age of these people were 30. They weren't too sick, but the same thing, they showed a significant improvement or I'm going to say significant, but we showed improvement in social communication, repetitive behaviors, motivation, social awareness, and social cognition. Pretty cool, right?
Yeah.
And these are the whole endpoints. So everybody's got better. And they also showed an improvement in their global functions, in this ASD global intersections and things like that. You follow? And the adults rated their ADHD as getting better also. So how are you feeling? So we observed them and then we asked them, how are you feeling with the ADHD? So these are the significant changes: inhibition, emotional control, planning and organizing, organization, materials, behavioral index, metacognition, and global executive composite. All of those trended positively, right? No serious side effects. All right. And 50% of the patients met a significant responder status, means they didn't just say they got better, they actually improved at a significant clinical level that you could see, yes, this is important. You follow?
Yeah.
So it's non-invasive, potentially safe intervention, promising treatment for the core feature of ASD, well received, and we can do further studies. Let me show you this new research. So this is also looking for at TPBM for autistic traits and ADHD. This is double-blind sham control, right? So it's an open-label thing of autistic children with ADHD, and they're going to look at this. They're going to use the same device, I think they're going to use the same device. They're going to go 20 minutes, 10, 20, 30, and 40 minutes at home, which is much more in line with what we're doing, right? Because this clinical stuff in cases that we do informs the literature to say, how much can we take? So if you look at the dose, 20 minutes daily, 30 minutes daily at home versus 5 minutes 3 times a week, it's just a much greater power, much greater juice, right? So they're looking at these distinctions and the connection between adult ADHD and ASD when they do their study. And they see that there's autism and autism traits is what they were talking about. So they're also going to look at this to design the efficacy of autistic traits in children, again, with a fixed dose as it goes up and up, and looking just like we're going to do. Start a little bit, do a little more, and observe. Nathan's doing better. Nathan's doing better. Nathan's doing better. Okay? Just to let you know. These are the 3 studies that are ongoing. Okay?
Yeah.
This is from the clinicaltrials.gov. This is 2 of them are done in Massachusetts by the group that I went over first. And this next one is done by Jalika Light. This is a small little device that they're wearing. Again, temporal region, but it doesn't treat the whole brain, and it doesn't really do much of anything as far as the juice. What we're going to do is a lot more juice. These are the researchers. That's fine. These are some of the researchers. If you want to look over, you can look up some of these that think this. This is the other one that's happening at Mass General. Autism traits in children and adolescents with ADHD. They're going to look to see if those traits get better, as well as photobiomodulation in autism spectrum disorder. They're already started that trial, and they're starting that stuff right now. Okay. So that is my presentation.